Good morning. My name is Rebecca, and I'm going to be your nurse today. How are you?
I am doing good.
All right. Can you tell me your name?
Dora Guerra.
Well, hi, Miss Dora. Now, can you tell me how old you are?
I'm 52.
All right, Miss Dora. So you are in today for a general survey. So it's going to be an assessment of your head and neck. Is that okay?
Sure.
Okay. So I'm going to begin by letting you know if at any time during the assessment you feel uncomfortable or in any pain, just let me know. Okay.
Okay.
Okay. I'm going to ask you just a few questions. So you already have told me your name and age. Now, do you know who the president is?
Trump.
Okay, and do you know who the former president is?
Biden.
Okay. And do you know what day of the week it is?
Monday.
Okay. And would you say you have access to 3 meals a day?
I do.
Very good. Now, your BMI, which is your body mass index, is appropriate for your height and weight, so that is very good. Okay. Now, I noticed as you walked in, your mobility was nice and straight. Okay, I didn't notice any use of like a cane or a walker. Do you use any of those?
No.
Okay. I don't notice any physical deformities. Do you have any of those?
No.
Okay. And then I also noticed that your posture is nice and straight. Your clothing is nice and clean. It does show that you have good personal hygiene, so that is good. And would you say English is your primary language?
It is.
Okay, very good. And what about your mood? Would you say you're happy today?
Sure.
Okay, good. And would you say this is a normal for you?
Yes.
Very good. All right, Ms. Dora. So I'm just going to get my hands clean, and we're going to begin the assessment part. Okay.
Okay.
And just a reminder, if at any time you feel uncomfortable or any pain, just let me know. Okay.
Okay.
So I'm going to begin by looking at your head, your cranium, which is your head. Okay. I'm going to be looking for any lumps, bumps, or bruises. I'm looking at the shape of your head. It is symmetrical and round. Okay. I'm going to be looking at your scalp. Okay, I'm looking for any redness, flakiness, or infestation. Okay, I do not see any. I do notice that your hair is thin and dark brown, and it is evenly distributed, so that is good. All right, Ms. Dora. Now, when I push on your head, do you have any tenderness?
No.
No. Alrighty. Okay. Now, Ms. Dora, I'm just gonna move down to your face. Okay, I'm going to be looking at your eyes. They're symmetrical. They are round. I'm just looking for any redness, swelling, or discharge. Okay, I'm going to be looking at your eyebrows. They are symmetrical. Can I get you to close your eyes? I'm looking at your eyelids, your eyelashes. Everything seems to be symmetrical. All right, Ms. Dora. Okay, so I'm going to go ahead and get my pen light out. Okay. I'm going to get you just to look straight at me, and I'm going to be shining some light in your eyes, okay?
Okay.
Very good. All right, Ms. Dora, can I get you to look at my pen light? And then look at the wall behind me, and then look back at my pen light? Very good. So your eyes are equal, they're round, they're symmetrical, they're reactive to light and accommodation, so that is good, okay?
Okay.
As far as your sinuses, I'm going to go ahead and press on your sinuses. These are your frontal sinuses. These are your maxillary sinuses. Any tenderness?
No.
Okay, very good. I'm going to be looking at your nose for any redness, swelling, or discharge. I do not see any. It is symmetrical. From there, I'm going to be looking at your ears. Okay. I'm looking for any redness, swelling, or drainage. Okay. Now, do you feel any tenderness when I push on them?
No.
Okay. Very good. Now I'm going to move down to your lips. I'm just looking at making sure it's symmetrical. So they are symmetrical. Your lips are symmetrical. They're pink and moist and with no cracks or lesions present. Okay. From there, I'm going to move down to your neck. Okay. So I'm just looking for any lumps, bumps, or bruises, or any visible pulsations. Okay.
Okay.
Alrighty, I'll get you to look up. I'm looking at your trachea. It is nice and midline. Okay, I know that. Okay. And your neck is symmetrical. Your trachea is midline. I'm going to be rolling my fingers over your lymph nodes, and I'm going to be calling them out as I go. Okay, and if at any time you feel any tenderness or any pain, just let me know. Okay.
Okay.
Alrighty, so I'm going to begin by rolling my fingers over your pre-auriculars, okay, right here in front of your ears, okay. your post-auriculars that are right here behind your ears. Okay, very good. Okay, then I'm going to move to the back of your neck. This is going to be your pre-occipital. Okay, alrighty. Okay, alrighty. Then I'm going to move down to right here. This is your gastric lymph nodes. It's just going to be these are going to be your tonsils. Your submandibular, that's right here underneath your chin. And your submental, that's right here on the front. Okay, alrighty. And then I'm going to move down to your neck, okay? So on your neck, I'm going to be filling over your posterior cervical. I'm going to go posterior cervical. Okay, very good. Here in the back. Your superficial cervical, right here on the sides. Okay, very good. Okay, your deep cervical, that's right here in the middle and the front. Okay, very good. Okay, and then I'll get you to shrug your shoulders. Alrighty, and I'm going to be looking over your supraclavicular. Do you have any pain or tenderness?
No.
Alrighty, Miss Dora, you can relax. Okay, so from here, I'm just going to go a step behind you, okay? I'm going to be examining your thyroids. Okay, I'm going to place my fingers here. Alrighty, any tenderness?
No.
Okay, so I'll get you to lean your head slightly back and then to the right. Okay, go ahead and swallow. Okay, and then you can turn your head, tilt it to the left, and go ahead and swallow. Very good. Okay, alrighty, do you have any pain?
No.
Alright, Ms. Dora. Now, did you have any questions for me?
No, I don't.
Alright, Ms. Dora, well, thank you so much, and this concludes our general survey, okay?
Thank you.
You have a good day.
You too.
Okay, I'm going to begin my verbal report over my general survey. So I was presented with, my patient is AO times 3, consumes a regular diet that consists of meats, fruits, and vegetables. Her BMI is 24, indicating a healthy range. Her posture was erect. Her gait was smooth and steady. She describes today's mood as being happy and indicates this is normal for her. Her speech is clear and articulate. Her English is her primary language. She was dressed appropriately for the weather, and her clothing is nice and straight, with nice and clean, without no body odor. I then began my assessment. I began by assessing her cranium. Her cranium is smooth and non-tender. Her scalp is intact with no visible redness or flakiness. Her hair was thin, dark brown, and evenly distributed. Her eyes were symmetrical with no redness, swelling, or drainage noted. Perla. Redness, swelling, or discharge noted. Perla. Her sinuses were non-tender. Her nose was symmetrical with no visible redness, swelling, or discharge noted. Her ears were symmetrical with no redness, swelling, or drainage noted, and non-tender. Her lips were symmetrical, pink and moist, no cracks or lesions present or visible, with slight droopiness noted. Her neck was symmetrical with no visible pulsations. Her trachea was midline. Her lymph nodes